Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on diabetic nephropathy. So let us discuss what is diabetic nephropathy. As you know, the diabetic nephropathy is a serious complication of type 1 diabetes and type 2 diabetes. It's also called diabetic kidney disease. In the United States, about 1 in 3 people living with diabetes have diabetic nephropathy. Diabetic nephropathy affects the kidney's ability to do their usual work of removing waste products and extra fluid from your body. The best way to prevent totally diabetic nephropathy is by maintaining a healthy lifestyle and adequately managing your diabetes and high blood pressure. Over many years, the condition slowly damages your kidney's delicate filtering system. Early treatment may prevent or slow the disease progression and reduce the chances of complication. Kidney disease may progress to kidney failure, also called end-stage kidney disease. ESRD. Kidney failure is a life-threatening condition, and at this stage, treatment options are dialysis or kidney transplant. So what are the symptoms? In the early stages of diabetic nephropathy, you would most likely notice any signs or symptoms. In later stages, signs and symptoms may include worsening of blood pressure control, protein in the urine, swelling of feet, ankles, hands, or eyes, and increased need to urinate, increased frequency of urine, and reduced need for insulin or diabetes medicines, and confusion or difficulty concentrating, shortness of breath, and loss of appetite, disorientation, and nausea and vomiting, persistent itching, fatigue, and ultimately patient might go in kidney failure and in comatose condition. So when to see a doctor, make an appointment when your doctor. If you have any signs or symptoms of kidney disease, if you are living with diabetes, visit your doctor early or as recommended for tests that measure kidney function. What are the causes of diabetic nephropathy? Diabetic nephropathy results when diabetes damages blood vessels and other cells in your kidney. How the kidneys work. Your kidney contains millions of tiny blood vessel clusters, glomeruli, that filter waste from your blood. Severe damage to these blood vessels can lead to diabetic nephropathy, decreased kidney function, and kidney failure. So diabetic nephropathy causes diabetes is a common complication of type 1 and type 2 diabetes. Over time, poorly controlled diabetes can cause damage to blood vessel clusters in your kidneys that filter waste from your blood, and this can lead to kidney damage and cause high blood pressure. High blood pressure can cause further kidney damage by increasing the pressure in the delicate filtering system of the kidneys. Risk factors: if you are living with diabetes, factors that are involved can increase your risk for diabetic nephropathy, which include uncontrolled high blood sugar, hyperglycemia, uncontrolled high blood pressure, hypertension, being a smoker, or high blood cholesterolemia or hypercholesterolemia, and obesity, and a family history of diabetes and a kidney disease. What are the complications? Complications of diabetic nephropathy may develop gradually over months or years, and they may include fluid retention, which could lead to swelling in your arms, legs, high blood pressure or fluid in your lungs, pulmonary edema, and pedal edema, a rise in potassium levels in your blood, hyperkalemia, heart and blood vessels disease, cardiovascular disease, which could lead to stroke, and damage to the blood vessels of the light sensitive tissues at the back of your eye, diabetic retinopathy, and reduced number of white blood cells to transport oxygen, causing anemia, foot sores, erectile dysfunction, diarrhea, and other problems related to damage to the nerves and blood vessels and autonomic nervous system, bone and mineral disorders due to the inability of the kidney to maintain the right balance of calcium and phosphorus in the blood, and pregnancy complications that carry risk for the mother and the developing fetus, irreversible damage to your kidneys, and stage kidney disease, eventually needing either dialysis or a kidney transplant for survival. Then what is the preventive measures to reduce your risk of developing diabetic nephropathy? Keep regular appointments for diabetes management. Keep annual appointments or more frequent appointments recommended by your healthcare team to monitor how well you are managing your diabetes and to screen for diabetic nephropathy and other complications. Treat your diabetes with effective treatment of diabetes. You may prevent or delay diabetic nephropathy. Manage high blood pressure or other medical conditions. If you have high blood pressure or other conditions, comorbid conditions that increase your risk of kidney disease, work with other doctor to control them, and follow instructions on over-the-counter medications. Follow instructions on the packages of non-prescription pain relievers such as aspirin and non-steroidal anti-inflammatory drugs such as naproxen and ibuprofen. For people with diabetic nephropathy, taking these types of painkillers can lead to kidney damage and maintain a Healthy weight. If you are at a healthy weight, work to maintain it by being physically active most days of the week. If you need to lose weight, talk with your doctor about weight loss strategies such as increasing daily physical activity and consuming fewer calories. Do not smoke. Cigarette smoking can damage your kidneys and make existing kidney damage worse. If you are a smoker, talk with your doctor about strategies for quitting smoking. Support groups, counseling, and some medications can all help you to stop. Then what is the diagnosis and treatment? As far as diagnosis is concerned, diabetic nephropathy is usually diagnosed during routine testing that are the part of your diabetic management. If you are living with type 1 diabetes, screening for diabetic nephropathy is recommended beginning 5 years after your diagnosis. If you are diagnosed with type 2 diabetes, screening will begin at the time of diagnosis. Routine screening tests may include urinary albumin test. This can detect the blood protein albumin in your urine. Typically, the kidneys do not filter albumin out of the blood. Too much of the protein in your urine can indicate poor kidney function. Albumin and creatinine ratio. Creatinine is a chemical waste product that healthy kidneys filter out of the blood. The albumin over creatinine ratio, a measure of how much albumin is in the urine sample relative to how much creatinine there is, provide another indication of kidney function. And glomerular filtration rate, GFR. The measure of the creatinine in a blood sample may be used to estimate how quickly the kidneys filter blood. Glomerular filtration rate, low filtration rate indicates poor kidney function. Other diagnostic tests may include the following imaging tests. Your doctor may use an X-ray and ultrasound to assess your kidney's structure and size. You may also undergo CT scanning and magnetic resonance imaging to determine how well blood is circulating within your kidneys. Other imaging tests may be used in some cases, and kidney biopsy. Your doctor may recommend a kidney biopsy to take a sample of the kidney tissue. You will be given a numbing medication, local anesthetic, and then your doctor will use a thin needle to remove small pieces of kidney tissue for examination under microscope. What is the treatment? The first step in treating diabetic nephropathy is to treat and control your diabetes and high blood pressure, hypertension. This includes diet, lifestyle changes, exercise, and prescription medications. With good management of your blood sugar and hypertension, you may prevent or delay kidney dysfunction and other complications. What are the medications? In the early stages of diabetic nephropathy, your treatment plan may include medications to manage the following. To control the blood pressure, medications called angiotensin converting enzyme inhibitors and angiotensin receptor blockers, ARBs, are used to treat high blood pressure such as losartan, and ACE inhibitors such as fosinopril, lisinopril, enalapril, and captopril are being used. For blood sugar control, medications can help control high blood sugar in people with diabetic nephropathy. Metformin, Fortamet, Glumetza, others improve insulin sensitivity and lowers glucose production in the liver. Glucagon-like peptide 1 GLP-1 receptor agonists help to lower the blood sugar levels by slowing digestion and stimulating insulin secretion in response to rising glucose levels. SGL2 two inhibitors limit the return of glucose to the bloodstream, leading to increased glucose excretion in the urine. Sitagliptin and others, linagliptins, are being used. And high cholesterol, lowering cholesterol drugs such as the statins are used to treat high cholesterol and reduce protein in the urine. Some medications for diabetes, glimepiride, rositinide, and metaglinides are used for lowering the blood sugar levels and controlling the blood sugar. And glimepiride and glyburide are being used. And then kidney scarring, phenylalanine disrupt molecular activity believed to cause inflammation and tissue scarring in diabetic nephropathy. Research has shown that the drug may reduce the risk of kidney function decline, kidney failure, cardiovascular death, non-fatal heart attacks, and hospitalization for heart failure in adults with chronic kidney disease associated with type 2 diabetes. Your doctor will likely recommend follow-up testing at regular intervals to see whether your kidney disease remains stable or progresses. Treatment for advanced diabetic nephropathy: if your disease progresses to kidney failure and stage kidney disease, your doctor will likely discuss options for care focused on either replacing the function of your kidneys or making you more comfortable. Options include kidney dialysis. This treatment removes waste products and extra fluid from your blood. The two main types of dialysis are hemodialysis and peritoneal dialysis. In the first, more common method, you may need to visit a dialysis center and be connected to artificial kidney machine about 3 times a week, or you may have dialysis done at home by a trained caregiver. Each session takes 3 to 5 hours. The second method may be done at home as well. Then the another option is treatment transplant option. In some situations, the best option is a kidney transplant or a kidney pancreas transplant. If you and your doctor decide on transplantation, you will be evaluated to determine whether you are eligible for this surgery. Then the management of the symptoms. If you have chosen not to have dialysis or a kidney transplant, your life expectancy generally would be only a few months. You may receive treatment to keep you comfortable. Potential future treatments. In the future, people with diabetic nephropathy may benefit from treatments being developed using regenerative medicine. These techniques may help reverse or slow kidney damage caused by the disease. For example, some researchers think that if a person's diabetes can be cured by future treatments such as pancreas islet transplant or stem cell therapy, kidney function may improve. These therapies as well as new medication are still under investigations. Then some interventions and tests means to prevent and detect, treat, or manage this condition. Lifestyle and home remedies may be effective. Diet, exercise, and self-management are essential for controlling blood sugar levels and high blood pressure. Your diabetes care team may help you with the following goals: monitor your blood sugar level. Your healthcare provider will advise you on how often to check your blood sugar level to make sure you remain within your target range. Suppose HbA1c within the range of 7%. You may, for example, need to check it once a day, and before and after exercise. If you take insulin, you may need to check it multiple times a day. Be active most days of the week. Aim for at least 30 minutes or more of moderate or vigorous aerobic exercises such as brisk walking, swimming, biking, or running on most of the days for a total of at least 150 minutes a week. Eat a healthy diet. Eat a high fiber diet with lots of fluids and non-starchy vegetables, whole grains and legumes. Limit saturated fats, processed meat, sweets, and sodium. Eat alpha, omega fatty acids, and which are found in fish. Quit smoking. If you are a smoker, talk with your doctor about strategies for quitting smoking. Maintain a healthy weight. If you need to lose your weight, talk with your doctor about weight loss strategies. For some people, weight loss surgery is an option, which is liposuction and other bariatric surgery. Take a daily aspirin. Talk with your doctor about whether you should take a daily low dose aspirin to lower the risk of cardiovascular disease. Be vigilant. Alert doctors and familiar with your family history that you have diabetic nephropathy. They can take steps to protect your kidneys from further damage by avoiding medical tests that use contrast dyes such as angiograms and computerized tomography scans. Coping and support. If you have diabetic nephropathy, these steps may help you to cope with connect with other people who have diabetes and kidney disease. Ask your doctor about the support groups in your area or contact organizations such as American Association of Kidney Transplant or the National Kidney Foundation or American Kidney Fund for groups in your area. Maintain your usual routine when possible. Try to maintain your usual routine, doing the activities you enjoy and continuing to work if your condition allows. Then this may help you cope with feelings of sadness or loss that you may experience after your diagnosis. Talk with someone you trust. Living with diabetic nephropathy can be stressful, and it may help to talk about your feelings. You may have a friend or a family member who is a good listener, or you may find it helpful to talk with a faith healer, faith leader, or someone else you trust. Consider asking your doctor for a referral to a social worker or a counselor. Preparing for your appointment. Diabetic nephropathy is usually identified during regular appointments for diabetic care. After diagnosis of diabetic nephropathy, your overall treatment plan will address ongoing management diabetes and test to monitor changes in kidney function. If you have been recently diagnosed with diabetic nephropathy, you may want to discuss the following question with your doctor. How well are my kidneys functioning now? What treatment do you recommend? How do these treatments change or fit into my overall diabetes treatment plan? How will we know if these treatments are working? Questioning for ongoing appointments. Before any appointment with a member of your diabetes treatment team, ask whether you need to follow any restrictions such as fasting before taking a test. Question to regularly review with your doctor or other members of the team include: how often should I monitor my blood sugar and what is my target range? What changes in my diet would help me better manage my blood sugar, cholesterol, or blood pressure? What is the right dosage for prescribed medication? When should I take the medications? Do I take them with the food? How is the management of diabetes affecting treatment for other conditions? How can I better coordinate treatments or care? When do I need to make a follow-up appointment? Under what condition should I call you or seek emergency care? Are there brochures or online sources you recommend? Are the resources available if I am having trouble paying for diabetes supplies? What to expect from your doctor? Your healthcare provider is likely to ask you a number of questions at regularly scheduled appointments, including: do you understand your treatment plan and feel confident you can follow it? How are you coping with diabetes? Have you experienced any low blood sugar? And do you know what to do if your blood sugar is too low or too high? What's a typical day's diet like? And are you exercising? If so, what type of exercise do I need? How often I need? Do you sit for long periods of time? What challenges are you experiencing in the managing of your diabetes? So this was all about diabetic nephropathy. And I hope so that this topic would be more informative for the audience. And if you have liked this video, then don't forget to subscribe my channel and share this video with other individuals as well. And thank you for listening this video. Have a wonderful nice day.